What guides discuss neuromodulation devices for headache relief? Have you ever wondered what guides are available for neuromodulation devices that help with headaches? If you are curious about how these devices work and what recommendations exist, you are in the right place. Let's break it down. Several clinical and research guidelines focus on neuromodulation devices for headache relief, especially for migraines and cluster headaches. These guides cover everything from device assessment to safety and practical use. One important guide is the Clinical Trial Guidelines for Neuromodulation Devices in Migraine Treatment. This guide defines key terms and provides recommendations for assessing these devices in both adults and children. It also outlines ethical responsibilities for conducting clinical trials. The goal is to improve the quality of evidence supporting these therapies. Another key resource is the Reviews and Updates on Non-Invasive Neuromodulation Devices. This guide summarizes the current devices approved by the Food and Drug Administration for treating migraines and certain types of headaches. Devices like transcutaneous supraorbital nerve stimulation and non-invasive vagus nerve stimulation are discussed here. The guide covers safety, tolerability, and effectiveness, along with emerging technologies that are still being researched. Additionally, there are narrative reviews on neuromodulation techniques for headache management. These reviews focus on four main techniques: peripheral nerve stimulation, transcranial magnetic stimulation, deep brain stimulation, and spinal cord stimulation. They evaluate outcomes such as headache frequency and pain intensity reduction. These reviews highlight neuromodulation as a promising option, especially for chronic cluster headaches and migraines. Practical Neurology Updates on Non-Invasive Neuromodulation provide detailed information on how to use these devices. This includes guidelines on stimulation duration and frequency for treating migraines. It also discusses contraindications and side effects, ensuring users are well informed about their options. In summary, the main guides discussing neuromodulation devices for headache relief include clinical trial guidelines, narrative reviews, and practical updates. These resources collectively support the use of neuromodulation as a safe and effective option for managing migraines and certain cluster headaches. With ongoing research, the applications of these devices continue to expand, offering hope for many seeking relief from headaches.